Welcome to Northeast Iowa Area Agency on Aging, or more commonly known as NEI 3A. My name is Mike Donahue, CEO of NEI 3A, and it's my pleasure to welcome you and share what I believe is an exciting and informative review of the many programs and services available through NEI 3A. You will have an opportunity to hear from our talented program leaders describe in detail what makes each of these offerings so valuable to the consumers we serve in Northeast Iowa. Our mission at NEI 3A is to help older persons respond to their evolving needs and choices. This mission is centered on providing older persons with the ability to age in their communities as they choose, and our role is to assist in layering in programs and services that help them avoid institutionalization. Our vision is that all older persons have access to supports that empower them to live with choice and dignity in their communities. It is critical that as all of us age, we retain the ability to choose, and that ample programs and services necessary to do so can be found in our communities. This is what NEI 3A is committed to creating every day through the work of our dedicated team members. NEI 3A is one of 6 area agencies on aging in the state of Iowa, covering 18 counties in Northeast Iowa, with regional offices located throughout our public service area. As one of 626 area agencies on aging across the United States, we are committed to a tradition of empowering older persons, persons with disabilities, veterans, and caregivers to live in the setting of their choice. Services provided do not have a set cost. There are no income eligibility standards, and the agency administers federal, state, local, and optional contribution funding to support programs under the Older Americans Act.
Hello, my name is Greg Zars, Deputy Director. I've been with the agency since 2012. I support Older Americans Act programs, the SHIP TA Center, and the SMP Resource Center through planning, development, procurement, and advocacy. We categorize all services under 4 primary service pillars. The first pillar is connecting you to services to remain independent. This includes services such as information and assistance, options counseling, and case management. It also includes home and community-based services such as homemaker, chore, personal care, material aid, and transportation. Next up is promoting active aging with health-based programs. This includes health and wellness programs such as Tai Chi for falls prevention, A Matter of Balance, and Better Choices, Better Health as evidence-based health promotion programs and classes offered to individuals. After that, we have providing caregiver support. We include all caregiver services under this pillar. That includes information assistance, options counseling, and case management specific to caregivers, as well as respite services, caregiver counseling, and caregiver support groups. And finally, we have enhancing health with nutrition services. This includes home-delivered meals and congregate meals, as well as nutrition counseling.
Hello, I am Christy Wilchin, Regional Director based out of our Decorah office. I oversee the counties of Alma Key, Chickasaw, Clayton, Fayette, Howard, and Winneshiek. I am the Director of Lifelong Links, our Information and Assistance Call Center, as well as the Family Caregiver Program. Lifelong Links is Iowa's network of Aging and Disability Resource Center, otherwise known as ADRC. It is designed to link older Iowans, people with disabilities, veterans, and their caregivers with the information and resources that they need to plan for long-term independent living in their community. The information and assistance specialists are available 8 to 4:30 Monday through Friday. Self-guided searches are available 24 hours a day through the Lifelong Links website. LifelongLinks.org covers all 99 counties in Iowa. Lifelong Links can be reached by calling 866-468-7887. Calls are routed to the closest area agency on aging. The Area Agency on Aging staff are able to assist with basic information and assistance and can connect callers to the aging specialists for more complex and specific information. When calling Lifelong Links, everyone will receive a person-centered experience. The information and assistance specialists are trained to not only respond to the question or concern the individual is calling about, but to ask questions and listen to the concerns of the caller to see if there are other resources available to help the individual remain independent. Consumers connect with NEI3A through our information and assistance specialists at Lifelong Links. Our INA specialists triage the consumer, making referrals to the most appropriate program within NEI3A or externally to community referrals. The flowchart describes the triage process within NEI3A. If the consumer has a safety risk, they would be referred to our Elder Abuse and Prevention and Awareness program. If the consumer needs service coordination, they would be referred to options counseling if they have short-term needs, or case management if they need long-term advocacy and service planning. If the consumer has been recently discharged from a hospital or skilled nursing facility within 2 weeks, they are referred to our Iowa Return to Community program, which provides service coordination and follow-up for 90 days with the goal to prevent readmission to a facility. If the consumer is a caregiver in need of support, they would be referred to our Family Caregiver program. The caregiver specialist will then assist the caregiver and provide further service provision, such as options counseling, case management, support group, informal counseling, caregiver education, and respite. If the consumer needs nutrition or meals, they are screened by our INA specialist to determine if they are homebound. If they are homebound, they would be referred to our home-delivered meal options. Depending on where the consumer resides, they would receive a meal delivered by a volunteer to their home or direct shipped meals from Mom's Meals. If they are not homebound, the consumer has options to attend a congregate senior center site or an Iowa Cafe restaurant.
Hello, I'm Kara Furch, Regional Director for our Blackhawk region. I oversee the counties of Poweshiek, Marshall, Tama, Hardin, Grundy, Bremer, Butler, and Blackhawk. In addition, I oversee the programs of Options Counseling, Case Management, and Iowa Return to Community. Options Counseling and Case Management. When a person 60 years of age or older, or a person 18 years of age or older with a disability needs more specialized assistance in their home, they are referred to Options Counseling or Case Management. While the service provided to the client is similar, the main difference is Options Counseling is short-term, 90 days or less, where Case Management is anything over those 90 days and is oftentimes ongoing. For both Options Counseling and Case Management, a home visit is conducted to assess the safety of the home environment, a full needs assessment is completed, and an individualized care plan is developed which includes services and providers. We then explore all funding options. The aging specialist then coordinates the services on behalf of the client. We put a strong emphasis on client choice throughout this process, meaning the client is always in control of their plan and we never force services or providers that the client does not want or approve of. Application assistance may also be done during this time. Common applications that we assist with include Medicaid and waiver applications, SNAP benefits, LIHEAP, low rent housing, and rent rebate. It's important to note that all of these applications are ran through an outside agency. Once the application is submitted, we no longer have access or control over the application or the application process. NEI 3A has Older American Act dollars, known as Elder Service dollars, that can be used to pay for in-home services. The primary services we fund with Elder Service dollars are homemaker, nurse, and personal cares. A client must meet our internal funding guidelines in order to potentially access Elder Service dollars. Those guidelines include annual income, resources, and a priority score, which is determined by the client's ability to perform ADLs and IADLs. Access to these dollars is also based on if funds are available. The demand for these dollars is often greater than our budget, which causes the need for a wait list. Elder Service dollars must be used as funding of last resort. Clients who do receive Elder Service dollars will receive a monthly contribution statement. At a minimum, clients who are enrolled in options counseling or case management will receive the initial home visit, monthly phone calls, and quarterly home visits. Iowa Return to Community, or IRTC. The goal of the IRTC program is to reduce and eliminate readmissions to emergency rooms, hospitals, or nursing facilities. To qualify for this program, the client must be 60 years of age or older, live within our 18-county PSA, and they cannot have full Medicaid benefits like the elderly waiver. However, they can be approved for limited Medicaid, such as medically needy, Medicare Savings Plans, MSP, Qualified Medicare Beneficiaries, QUIMBY, or Specified Low-Income Medicare Benefits, SLIMB. They must have been discharged to the community from a hospital or skilled nursing facility within the past 2 weeks of us receiving the referral. The client must also agree to participate in the program. Enrollment in the IRTC program cannot exceed 90 days. Should needs still exist beyond the 90 days, the client can transition to our case management program. During the enrollment period, the aging specialist works very closely with the medical team. The process for IRTC looks very similar to that of case management and options counseling. A home visit is conducted to assess the safety of the home environment, a full needs assessment is completed, and a care plan specific to the individual client is developed. Services and providers are discussed, and funding options are explored. The aging specialist then coordinates the services on behalf of the client. Application assistance may also be provided. All clients enrolled in this program will receive at a minimum the initial home visit and monthly phone calls. NEI 3A has specific dollars to be used for the IRTC program to pay for in-home services like homemaker, nurse, home health aide, home delivered meals through Mom's Meals, and transportation specifically to medical follow-up appointments. Clients who meet the qualifications for this program and meet NEI 3A's internal funding guidelines could be eligible for up to $350 a month in services as long as funds are available. A key distinction to this program is the 30, 60, and 90-day post-discharge phone calls that are made to track any readmissions that may have occurred. Although not a requirement of this program, we do in some locations have aging specialists conducting rounds at the hospital to meet potential clients' bedside. Also, in some locations, we have access to the healthcare system's electronic patient record system, so hospital discharge planners can make referrals to NEI 3A from the system they are already working in rather than calling lifelong links. IRTC continues to be one of our fastest growing programs.
Hello, I am Christy Wilchin, Regional Director based out of our Decorah office. I oversee the counties of Alma Key, Chickasaw, Clayton, Fayette, Howard, and Winneshiek. I am the Director of Lifelong Links, our Information and Assistance Call Center, as well as the Family Caregiver Program. Our Caregiver Support Program provides information and support to empower informal caregivers. An informal caregiver is defined as a family member or other individual 18 or older that is providing informal care to a person aged 60 or older, or to an individual of any age with Alzheimer's disease or related disorder. NEI 3A offers many specific services through the Family Caregiver Program. One is Caregiver Information and Assistance. It is a service that links the caregiver with current information on opportunities and services available within the community. Options Counseling is a short-term case management specifically to assist the caregiver in his or her caregiving role. Case management is long-term advocacy for the caregiver. If a caregiver is receiving funding from our agency for in-home support, such as respite care, the caregiver is enrolled in our caregiver case management program. Another service we provide to caregivers is caregiver counseling. It provides emotional support and reassurance to caregivers to assist them in making decisions and solving problems relating to their caregiver roles. We offer caregiver support groups. NEI 3A social workers facilitate support groups for caregivers to discuss their common experiences and concerns and develop a mutual support system. Caregiver training and education. Powerful Tools for Caregivers is a 6-week workshop to help caregivers reduce stress, improve self-confidence, manage time, solve problems, communicate their feelings, make tough decisions, and locate resources. Another service we provide caregivers are supplemental services, which are goods and services provided on a limited basis to complement the care provided by caregivers. An example is GrandPads. The GrandPad is a smart, simple, and safe way to virtually connect seniors with family, friends, and caregivers. And lastly, respite care. Respite care provides a home health worker to take over for caregivers, allowing them a brief period of relief or rest so they can recharge and balance their roles as a caregiver.
Hello, my name is Stacy Spears. I serve as the Regional Director for Dubuque, Delaware, Jackson, and Buchanan counties. I'm also the Director of the Elder Abuse Prevention and Awareness Program. I oversee the Home Meds program, and I work with the agency's dementia-friendly initiatives. I've been with NEI 3A for 9 years, and I'm located in Dubuque. There are 4 eligibility requirements for admission into the Elder Abuse Program. A person must be age 60 or older. They must be experiencing or at risk of experiencing abuse, neglect, or financial exploitation. They cannot reside in a long-term care facility, and they must want assistance. The EAPA program is strictly voluntary, only in cases of imminent danger and where a person's competency is in question will staff seek involuntary assistance. We receive several calls from well-intentioned people wanting us to intervene on behalf of an older adult, such as a friend, family member, or acquaintance that they suspect is being abused, neglected, or failing to take care of themselves. While the elder rights specialist follows up with the person for whom there's concern, we will not take any action without the older adult's permission. This is where the concept of dignity of risk comes into play. All adults, unless they have been declared incompetent by the court, possess the right to make decisions, even if those decisions appear unwise or unhealthy. To illustrate this point, imagine an older woman with extreme hoarding behaviors. Over the years, she has accumulated so many possessions that in the event of a fire, there would not be a clear and safe path for her to escape. This woman is fully aware of the danger that her hoarding presents. However, she does not want to remove any of her possessions from her home. While we may not agree with her choice, we must respect her right to make it. So how does the program work? Referrals come to us through Lifelong Links and are assigned to an elder rights specialist. When it's determined that eligibility requirements are met, a person is admitted into the EBA program. The elder rights specialist conducts an in-home evaluation to assess needs and identify risks. Staff then works with the consumer to develop a person-centered intervention plan and coordinate services that will help meet the identified needs and reduce or eliminate risks. In certain situations, we may be able to provide funding for services. For example, in situations where a person must move in order to escape an abusive relationship, we have paid for moving expenses, temporary hotel stays, and the first month's rent in a new apartment. We've also paid for cleaning services in cases where a person's home is unsafe due to hoarding. Once services are in place, we provide ongoing assessment and support until the immediate crisis is resolved. As mentioned earlier, this is a short-term program, usually no longer than 90 days. Consumers requiring ongoing services are enrolled in our case management program upon discharge from our EVA program. Elder abuse is any action or inaction that causes or has the potential to cause harm to an older adult. Every year, 1 in 10 Americans aged 60 and older experience some form of elder abuse. It cuts across racial, cultural, and socioeconomic circumstances and can take many forms, including physical, emotional, and sexual abuse, neglect, self-neglect, and financial exploitation. The consequences of elder abuse are grave. Older adults who experience abuse and neglect face a heightened risk of health complications, hospitalizations, nursing home placements, and premature death. The Elder Abuse Prevention and Awareness Program, or EAPA for short, is a specialized form of short-term case management that provides assistance to older adults who are experiencing or at risk of experiencing abuse, neglect, or financial exploitation. The Elder Abuse Prevention and Awareness Program is funded through the Older Americans Act and has 4 main goals. First, and most importantly, is responding to reported concerns of older adults who are either experiencing or at risk of experiencing abuse, neglect, or financial exploitation. The second goal is networking and coordinating community resources to respond to the needs of older adults. We do this by building relationships with community partners such as law enforcement, healthcare workers, homelessness coalitions, first responders, and other service providers. We connect older adults to these partners who can help facilitate their safety and well-being. Serving as a resource for professionals working with older adults is the third goal of the EAPA program. Our experts provide consultations with people such as church leaders, home health aides, financial advisors, and assisted living staff when they encounter concerning situations with an older adult. We answer their questions, offer them information and educational materials, and when necessary, connect them to the appropriate reporting entities. The final goal of this program is raising awareness of elder abuse in our local communities. We do this by offering professional trainings, speaking to community groups, participating in community outreach efforts, creating and distributing informational materials, and by promoting elder awareness events such as World Elder Abuse Awareness Day.
My name is Janet Bowles. I'm the Director of Nutrition Services. I oversee meal programming and health promotion programming, both evidence-based and non-evidence-based. I've been with NEI 3A for 15 years. Our nutrition programs include both congregate meal sites or senior centers and home-delivered meals. Individuals who participate in our meal program must be 60 years of age or the spouse of someone who is at least 60. All our meals are provided on a contribution basis, and an individual's ability to contribute does not factor into any program eligibility. Each meal is evaluated by a dietitian and must meet nutrition requirements for 1/3 of the dietary needs of an older person. We purchase meals for our programs from catering services, drop-ship prepared meal programs, or local restaurants. Our traditional congregate meal sites and senior centers provide nutritious meals and socialization for consumers, as well as additional education, health and wellness programming, and referral options for those who are looking for additional services. We rely on local volunteers in many cases to help these sites, and have found that the most successful locations are heavily supported by those trusted volunteers. Our congregate sites may serve meals 1 day per month, 2 or 3 days per week, or daily. We fully support the needs and desires of each community we serve. Iowa Cafe is a new initiative that allows individuals to attend a local restaurant and participate in the congregate meal program by choosing a special menu that has been approved by a dietitian to meet the needs of an older person. These restaurants have been selected based on suggestions from the community, compliance with health and food safety regulations, and how well the location fits in our planning process. For instance, we have some counties without a traditional congregate meal site, and we have worked to partner with a restaurant to serve that county. Our home-delivered meal program is provided via 3 different options: daily hot meals delivered via volunteers, hot prepared meals delivered 2 or 3 times weekly with a prepared meal for the other days, but delivered at the same time, or a box of up to 10 meals delivered directly to the consumer every 2 weeks. The consumers are offered one of these options, depending on what service is available in their location. Ideally, we provide daily meal delivery whenever possible. The personal contact is an important component in our efforts to reduce social isolation and to provide a safety check on frail consumers. From time to time, our programs may require a wait list. When this happens, consumers are provided information about our policy and the process that we follow. We use a priority system that identifies those consumers in greatest need. If an individual is placed on a wait list, we offer additional resources to assist them until we can provide the service they are requesting. Nutrition education programming is provided to our nutrition participants. We deliver it in person when possible, but have implemented a video series on our website and utilize a mailing list to provide the Words on Wellness newsletter from Iowa State Extension. We recognize the importance of health and wellness and partner with other organizations to help reduce senior hunger, including Farmers Market voucher from the Iowa Department of Agriculture, elderly food boxes from the food bank, and we share information on our mobile food pantry options.
NEI 3A provides health and wellness programming through evidence-based and non-evidence-based programs. Both are important to help provide healthy aging and fall reduction, which is a serious concern for older adults. Evidence-based programs are usually licensed and provide significant research to support positive outcomes for those who complete the class. These programs are led by a trained instructor, coaches, or peer leader. They are periodically updated and are supported by master trainers. Fidelity to the program is key to achieving the outcomes that are expected, such as reduced fall risk, increased activity levels, decreased emergency room visits and other healthcare utilization, and improvements in strength, flexibility, and balance. Classes are offered at our congregate meal sites, libraries, churches, and through park and rec programs. Specific evidence-based programs include A Matter of Balance, which is a fall risk reduction program aimed at individuals who are limiting their activities due to concerns about falls. It targets frail, community-dwelling older adults. Chronic Disease Self-Management, or Better Choices, Better Health, provides information for participants to learn how to manage symptoms related to a variety of conditions. Improvements are often seen in pain control, quality of sleep, and fall reduction. Home Meds is an evidence-based medication safety program that was developed to screen for common medication-related problems found in adults age 60 and older. It starts with an in-home assessment to gather information about both prescriptions and over-the-counter medications a person's taking. This information is then entered into a computerized assessment that is reviewed by a pharmacist for any potential alerts. If a concern is noted, the pharmacist contacts the participant's physician for a review and discussion of a potential medication change. Individuals completing the home med assessment are provided with a complete medication list that can be taken to doctor's appointments or given to family members. Powerful Tools for Caregivers is an evidence-based class that helps caregivers take better care of themselves while caring for a friend or relative. Overall, it has been shown to have a positive impact on caregiver health. 6 class sessions are held once a week and led by experienced class leaders. The program gives caregivers tools to help reduce stress, improve self-confidence, manage time, set goals, solve problems, better communicate feelings, make tough decisions, and locate helpful resources. Tai Chi for arthritis and fall prevention is one of our most popular offerings and can be delivered with minimal space, equipment, and supplies. Participants learn a series of 12 forms from the ancient Chinese exercise program using the Sun style of Tai Chi. Balance, strength, and improved flexibility combine to reduce falls. Walk with Ease is a walking program that can be conducted in a group or individually. Often held as a walking group, the participants learn about strength and overall conditioning. This program is sponsored by the Arthritis Foundation and offers supports for individuals who feel they are unable to exercise due to arthritis. Non-evidence-based programs also offer education related to health and wellness, but are not licensed programs. These programs are provided by nutrition staff on a monthly basis. Our non-evidence-based programs provide health promotion activities and screens to help people learn more about decreasing or managing health conditions such as diabetes, hypertension, or obesity. In partnership with a local community-based organization, we offer Seniors in Motion, either in person or virtually. This popular program is held twice a week and geared towards older adults. We encourage nutrition staff to provide blood pressure checks, diabetes screenings, fitness professional visits, and fall screenings as part of our meal site programming.
NEI3A's transportation program provides paratransit and fixed route public transit for people age 60 and over who are no longer able to drive. Paratransit is also known as a door-to-door service. This means that the bus comes to a person's home, assists them safely into the vehicle, drives them to their destination, and assists them safely out of the vehicle. Fixed route service is the traditional city bus line, where somebody waits for the bus at the bus stop, rides the bus until they get to their destination, and then gets off the bus. The goal of this program is to help individuals with transit to medical appointments, shopping, and other events so they can continue to live and thrive in their communities. Please note that since NEI3A's service area is primarily rural, transportation services are not available to everyone in the service area. Most services are limited to population centers. Interested consumers may call Lifelong Links to begin the process. Eligible riders may ride up to a maximum number of rides per month. This maximum varies based on the local public transit partner, the cost of the ride fare, and availability of the transit service in their respective area. Most riders may use between 16 to 20 rides per month. Longer intercity rides are approved on a case-by-case basis due to their large and varied costs. Participants are provided with an opportunity to contribute toward the cost of the service.
Hello, my name is Megan Zimmerman. My role at NEI3A is the Dementia Friendly State Coordinator for the Dementia Friendly Iowa Initiative. In 2019, I became involved as an intern with NEI3A to help launch local, initial dementia-friendly efforts in the Cedar Valley. I've been at NEI3A ever since, and I love my job. I look forward to sharing about the Dementia Friendly Iowa program with you. Dementia Friendly Iowa is a collaborative effort with the Iowa Association of Area Agencies on Aging, or I4A. NEI3A currently receives funding from the Iowa Geriatric Education Center, or GWEP grant, which currently funds about half of the program. The statewide Dementia Friendly Initiative officially launched in the summer of 2021. It is a somewhat unique program in that it serves areas outside the borders of NEI3A's 18-county region. The overall goal of Dementia Friendly Iowa is to promote change in education in communities across the state to create a more informed, safe, and respectful place for people living with dementia and their caregivers. We want to see Iowa become a place where people with dementia can not only live, but thrive. We do this through two primary ways. One is educating communities and launching dementia-friendly community initiatives. At this time, I am the only full-time staff member dedicated to this initiative, but we will be adding a part-time dementia service specialist in the near future as our next 5-year grant has added that position. Across Iowa, we have a team of around 200 volunteers that are very passionate about building a more dementia-friendly Iowa. So why do we do this? Well, in Iowa, we have over 62,000 people living with dementia, and that's likely low because dementia is not always diagnosed correctly. In Blackhawk County, just for reference, at least 2,600 people are living with dementia. And this can be surprising, but the majority of people living with dementia are living in the community. They're going to all the places that everyone else goes, to the gym, the bank, the grocery store, the library, their church, the community center, on, just like the rest of us. Unfortunately, dementia can make doing these things more difficult, and often the community is undereducated and underprepared to serve this population. So that's where the idea of dementia-friendly efforts come in. And as I mentioned, the program has two main initiatives. The first is offering Dementia Friend Sessions, and the second is helping launch dementia-friendly communities, which are modeled after the same two initiatives of the nationwide network of Dementia Friendly America. First, let's talk about Dementia Friends. Dementia Friends USA is a part of a global social awareness movement. It's an individualized approach to education with the goals of increasing empathy and decreasing stigma surrounding dementia. They're 1-hour information sessions, both virtual or in person, and we offer these to anyone and everyone, including different groups and organizations. Anyone who attends a session becomes a dementia friend and receives a certificate. During the session, dementia friends learn basics of dementia, they find out more about what it's like to live with dementia, gain tips for communication, and then are asked to turn their understanding into action, such as reaching out to a family member with dementia or being more aware in public settings like the grocery store. They also learn what our 5 key messages of Dementia Friends, which are really fighting some of the biggest misconceptions out there about dementia. So the first is that dementia is not a normal part of aging. Second, dementia is caused by diseases of the brain, Alzheimer's being the most common. Third, dementia is not just about having memory problems. Fourth, it's possible to live a good quality of life with dementia. And fifth, there's more to a person than their dementia. So as you might have noticed, those 5 key messages are really focused on reducing stigma. These sessions are led by our volunteer champions, which go through a training led by me. We have champions from all different backgrounds, ages, and geographical locations, and we also partner with all the other area agencies on aging to have trained champions on staff. We have champions in all the major universities, senior living communities, businesses, faith-based organizations, and so much more. And we really rely on these champions to offer sessions to the public and their circle of influence. So in the first 3 years of our program, as we're wrapping up now, we have trained close to 11,000 dementia friends. But it's not really about just the numbers. Each dementia friend ideally making a small positive impact in their community to be a friend to those living with dementia. And we've heard lots of stories about the impact and the actions that these dementia friends have chosen. We've heard people befriend someone with dementia at their gym. We've heard other families say that they came to the Dementia Friends session and walked away with resources that they were able to call and get connected to when they felt lost after diagnosis. So really our goal is, that 1 hour education, but then long-term connection to supports and people taking action after our sessions. If we can have more and more actions taken from every dementia friend that attends a session, we'll really start to see a huge impact on the lives of people with dementia in our state. So that sums up Dementia Friends side of the initiative. So in a nutshell, it's raising awareness and reducing stigma at the individual level. On the flip side, the other focus of our work is with dementia-friendly communities. The community side of the initiative is more focused on bringing a whole community together at more of a macro or larger scale level. Becoming a dementia-friendly community and being recognized and joining the DFA network means a community is engaging in the process to become more dementia-friendly. A dementia-friendly community initiative is a community-wide approach. It's cross-sector and collaborative to better support people living with dementia and their care partners. Community initiatives are meant to be grassroots and driven by local volunteer action teams, which should include people with dementia as key members. The action team should also include people from key organizations, faith-based organizations, healthcare systems, local businesses, and more. These efforts seek to increase strengths and fill gaps when it comes to support people with dementia in their community. Then they must apply through Dementia Friendly America and also apply with letters of support. The first official dementia-friendly community in Iowa was Cedar Valley, which was in 2019, and the efforts of the Cedar Valley helped inspire and launch the statewide initiative. As of today, which is June 2024, 7 communities in total in Iowa have been recognized as dementia-friendly communities. So that's Cedar Valley, Maquoketa, Vinton, Johnson County, Dubuque, Lynn County, and Clarinda. And many other communities are actively working towards joining the Dementia Friendly America Network. It's really exciting to see the impact and to serve as a catalyst for this important programming and education in the community. A lot of community actions include doing dementia-friendly business trainings, which we also oversee and recognize any sector of businesses in the community. We also see communities doing large public offerings of dementia friend sessions, launching support groups, memory cafes, distributing resource lists, partnering with their local library for dementia-related book clubs, doing community memory screenings, working with a faith-based community to do dementia-friendly worship service, and so much more. So all of these efforts made within the dementia-friendly community initiatives and our dementia friend sessions across the state help lead to a more dementia-friendly Iowa.
NEI3A is proud to house 2 national resource centers. Currently, NEI3A is the only area agency on aging in the country that operates any national resource centers. They are funded by federal grants. One of these national centers is the Senior Medicare Patrol Resource Center, more commonly called the SMP Resource Center. NEI3A has operated the SMP Resource Center since its inception in September 2003. The other national center is the State Health Insurance Assistance Program Technical Assistance Center, more commonly called the SHIP TA Center. NEI3A has operated the SHIP TA Center since its inception in September 2014. Both centers are grant funded by the Administration for Community Living, ACL, at the U.S. Department of Health and Human Services. ACL oversight of the centers is provided by the Office of Healthcare Information and Counseling. These competitive federal grants must be recompeted every 3 to 5 years. The type of grant is a cooperative agreement, which means that we work collaboratively with staff at ACL to design and carry out our services. The NEI3A staff of these two centers also work collaboratively. We engage many of the same national subject matter experts for providing education to SHIPs and SMPs. Our national subject matter experts address topics such as volunteer program risk and management, Medicare coverage, and healthcare fraud, errors and abuse, and trends. Both centers offer resources, training, and technical assistance to the federally funded SMP and SHIP grantees in all 50 states, the District of Columbia, Guam, Puerto Rico, and the U.S. Virgin Islands.
Nicole Liebau is the Senior Medicare Patrol, SMP, National Resource Center Director. Ms. Liebau has worked in nonprofit agencies for 15 years, with an emphasis in program and grant management. In her career, she spent her first 4 years as a marketing, volunteer, and membership manager throughout 6 counties in Northeast Iowa for a nonprofit organization. She has worked in the SMP, National Resource Center, since October 2015. For the first 3 years, she was the center's assistant director, but has been with NEI3A since 2012. In her current role as director, she is responsible for the center's coordinating efforts with the Administration for Community Living, or ACL, grant and contract management, technical assistance in developing written materials, webinars, and other center products. The SMP Resource Center currently is a 5-year competitive grant, and NEI3A will reapply for the grant in 2025. The SMP Resource Center's primary goal is to provide national program visibility, professional expertise, training, and technical support to maximize the effectiveness of the 54 Senior Medicare Patrol, SMP, projects in Medicare fraud prevention, outreach, and education. The SMP Resource Center is not a Senior Medicare Patrol project, and NEI3A does not house one of the SMP projects. The main areas of assistance the SMP Center offers is the national website, the national toll-free number, the national info at email address, multiple social media platforms and resources, and a password-protected library. Within the password-protected library, the SMP Resource Center provides and maintains an up-to-date learning management system, resources, training materials and manuals, and technical assistance.
Hi, I'm Jenny Paulson, Director of the State Health Insurance Assistance Program Technical Assistance Center, known more commonly as the National SHIP TA Center. I have worked for our agency for 21 years, and I have been in my current role for 9 years. I work remotely from my home office in Iowa City. So, what does the SHIP TA Center do? We are federally mandated to be a central source of information for and about the National State Health Insurance Assistance Programs, called SHIPs. We promote SHIPs on our website, shiphelp.org, on Facebook, on YouTube, and through a national toll-free number. We also provide training and technical assistance to the staff and volunteers of the 54 SHIP programs to help them do their work. This is accomplished through webinars, creating training manuals, providing one-on-one technical assistance by email and by phone, and by offering a password-protected website for self-paced training. When SHIPs log in, they can access online courses about Medicare, online certification tools, a resource library, a Medicare supplemental insurance cost comparison tool, news, and more. It may seem surprising that NEI3A houses the National Technical Assistance Center for SHIPs, but does not provide local SHIP services. NEI3A has demonstrated effectiveness serving since 2003 as the Senior Medicare Patrol, or SMP, National Resource Center helped. The SHIP TA Center service model is based on the SMP Center service model. Like SMP, SHIP is a national program with offices across the country. Though SHIPs are national, the local support they provide is the same. It's important to know that, depending upon the state or location, SHIP may go by a local name. In Iowa, these services are provided by the Iowa SHIP. The acronym is pronounced the same, but in Iowa it has 2 I's and stands for Senior Health Insurance Information Program. On this slide, you can see the kind of services that are provided by the SHIP programs. There are approximately 15,000 individual staff members and volunteers working for the SHIP program nationally. SHIPs are federally funded by the same office at the Administration for Community Living, or ACL, that funds our national center. SHIPs provide local help navigating Medicare. They offer unbiased help to Medicare beneficiaries, their families, and caregivers. Whether someone is new to Medicare, reviewing Medicare plan options, trying to save money on Medicare costs, need help appealing a denied claim, or has other questions about their Medicare, SHIP can help. Nationwide, SHIP counselors are members of their local community who have been screened, trained, and certified as Medicare experts. And again, many are volunteers. They work in a variety of locations depending on their state. You see some locations listed on this slide, including online. The COVID-19 pandemic caused SHIPs to pivot to online services, and though in-person services have resumed, many programs continue to offer Zoom counseling sessions and other virtual options. It is the SHIP TA Center's role to train SHIP directors, SHIP counselors, and SHIP coordinators of volunteers on the content they need to do their job. In addition to the Medicare and volunteer topics I've already mentioned, we provide training on professional well-being, professional development, communication skills, and diversity, equity, and inclusion. Last but not least, the SHIP TA Center provides the training and technical assistance needed for the SHIPs to be able to effectively and accurately report into their national data system required by ACL, called STARS. The SMP Resource Center and the SHIP Technical Assistance Center develop several joint resources. First is a monthly education package called the Medicare Minute. It is written by the Medicare Rights Center, a national partner of both the SMP and SHIP Center. NEI3A's SMP and SHIP Center staff contribute to the content and distribute the Medicare Minute to the SHIP and SMP networks. The Medicare Messenger is the SMP and SHIP Center's quarterly newsletter for the SMP and SHIP networks. Currently, there are over 5,000 recipients of this newsletter. It includes topics such as Medicare coverage updates, Medicare fraud trends, SMP and SHIP successful practices, volunteer management, and professional development. Together, the centers provide webinars, toolkits, fact sheets, and more to help the SHIP and SMP networks educate the public on all things Medicare coverage and on potential healthcare fraud, errors, and abuse.
Thank you for watching this presentation. Please feel free to reach out to respective program directors with additional questions or for more information and details.